Now, it's really my great pleasure to have brought Nancy Edwards back from the memories of the formation of the EHSI to share with us, her perspective. So I was so happy she accepted coming. So yeah, thank you very much. And Nancy Edwards, as many of you know, obviously, is a professor emeritus in the School of Nursing, University of Ottawa. She's a former scientific director of the Institute of Population and Public Health from 2008 to 2016, a real driving force in the EHSI and the directions it took. Now, professionally, Nancy is a nurse and epidemiologist who's worked in the field of global health and development for 40 years. She's a distinguished professor and professor emerita at the University of Ottawa and the recipient of numerous awards, including 3 honorary doctorate degrees. So really look forward to your views on what you heard yesterday. What we did well, maybe what we could do better.
I need the clicker. I see the clicker. I've got it. Thanks very much, Jeff. Good morning, everybody. It's really a pleasure to be here. I was very excited when Jeff got a hold of me. The opportunity to come back and hear what's been happening with all of your projects over the last 5 to 7 years is just fantastic. So you made my day. I hope I make yours. So I'm going to speak from the perspective of somebody who was a scientific director. We can tell stories, Brian, once you get off that Science Council. And my orientation is going to be a bit more on the population health side because that's my background. But certainly I heard many, and was involved in many discussions about how we bridge the work that's so essential in basic science and the population health work as we develop this RFA. So I'll just start with a couple of background of things that I think Brian did not touch on yesterday. This is actually what we put forward as our argument to Science Council about why we needed funding and what kind of transformative impact we expected from these teams. And I think I heard a lot of examples during the sessions yesterday, but I would encourage you to think about this as you have your discussions with CIHR and others who are still at that Science Council table about how you did achieve this. And also to think hard about what was it about the RFA that did or did not provide those opportunities for you. Because I think the transformative piece is so essential to any sort of bolus funding that CIHR provides. So you may have other ideas, I'm sure you do, about what transformation needs to look like as we go forward in this large field of environment and health. This is also, I think, important for you to understand in terms of how things get discussed or were discussed. Brian can correct me if it's changed at the Science Council table. And as large initiatives are brought forward for consideration, one needs to describe not only how they are transformative, as I just described, but also how does one differentiate what's happening in that initiative versus what's going on in other large multi-institute initiatives. This is a slide I actually used during my farewell address to show initiatives that our institute had been very involved in and led or co-led, as in the case of environments and health, to show how it was distinctive from other initiatives that we were involved in. So obviously we're looking for synergies, but we're also looking for what it is that this particular initiative might drive that other initiatives cannot do. And as part of our outreach, there was extensive outreach on this. We actually had a couple of false starts. One was, I think, because there was a perception that environments and health is so big. I can remember Dr. Boudet saying, you can't boil the ocean. Don't try to boil the ocean with this signature initiative. So how do you narrow down something like environments and health, which is, like we would probably all say, it's like everything, in one sense. So it was actually in this room where one of our colleagues suggested, think about nexus areas. And that just seemed perfect because it captured the wickedness of the problem and the complexity of the problem, which we didn't want to oversimplify. We wanted researchers to embrace that going forward. But we reached out extensively to many organizations. This is just one of, 50 examples. We reached out to individual researchers and got their input, government scientists, and so on. So I would just maybe encourage CIHR, Brian, are you listening, to think about, and it's documented, who we did reach out to. And some of those are your knowledge translation partners, I would say, even if they are not specific partners for the work that you have done in your particular project. So it might be worth going back and seeing who those organizations were, because it was a broad outreach. So let me start off with what I heard, and I listened to all your webinars. I thought they were great, well done. And what impressed me from those webinars and what I heard yesterday. So I was very impressed by the fact that I think you have all embraced the complexity of environments and health in the design of your projects, and complexity has that fear factor that goes with it, but you've tackled that. And I'm sure you all have a lot of reflections on that, and I think that's important to capture, actually. This is the essence of this field. What have you learned about working with complexity? I was impressed by how you have successfully implemented your plans despite COVID. I don't know how you guys did it. The resilience in this group and of your team members in getting through that pandemic as you were doing your research is really something you are to be applauded for. I was impressed by some of the different sophisticated measures of the environment that I heard about. This was actually something that came up at the Science Council table quite often in the lead up to the Environments and Health Initiative, where I often brought to the table, I'm hearing incredible precision and ability to measure the teeniest, tiniest things in genetics and with the microbiome, et cetera, et cetera. And you look at the environmental side of the measures that are being used, and they're so macro and broad and ancient, some of them, socioeconomic status, important, but it's just not enough. So I was very, very impressed yesterday with some of the measures I've heard that you were using and developing, and I think it's reshaping some of our understanding of what that gene environment and gene expression and so on looks like. So kudos to you. I was also very impressed by the diverse engagement processes that teams have used. And I think, again, that's an area for a lot of really good cross-learning going forward. Capacity building, you've all done that in spades. Great to hear postdocs standing up here yesterday, former postdocs, and saying, I'm now in a tenure track position. And, the renewal that's going on in this field and the exponential growth of capacity is so important to grow a field like this. I heard a lot of attention to structural determinants in gender, some confusion about intersectoral and intersectionality, so just watch your wordage on that. Reflections on how to learn from different knowledge systems was impressive, and that really felt almost like a sea change, the conversations I heard about that yesterday compared to 7 years ago. And your ability to capture the essence and outcomes of your research in 2 to 3 minutes was great. Good for you. I can't do it. I know some people went for 4, but even 4 minutes is impressive. I originally worded this as, what I didn't hear, but actually I think it's more what I'd like to know. Were you sufficiently and appropriately challenged by the RFA requirements? This is really important feedback for CIHR. Are there deliberate plans for scale-up? I didn't hear much about scale-up yesterday. So how are you going to scale up the use of environmental measures, of your interventions, of your community engagement processes, and so on? What's the pertinence of your work to the Sustainable Development Goals? I didn't hear SDGs mentioned yesterday. Canada reports on them. So how does that link up, or does it? What are the environmental caveats for basic science studies? I think you've got some really good insights on that. Those need to be brought to the table. What approaches have you actually taken to reduce health inequities? I've heard lots about health inequities, and I think it was just a matter of we didn't have time to, dig down. But how actually has your project dealt with that? Even at the level of your own team. What about institutional racism? Again, I heard reference to it, but how are you actually dealing with it? These are really important conversations. I didn't hear any reference to citizen science approaches, so I was intrigued as to why or why not that has been considered, or is that something you're thinking about going forward? You know, citizen science has been used extensively in many fields, including astronomy, bird watching, and so on. Is it a place, something that we can embrace in the work that we do? What about linking and sustaining and stewarding cohort data? I heard some reference to that yesterday and the many, many challenges that are involved, but I know there needs to be ongoing discussions about that. What about your experience of working across sectoral boundaries? You know, intersectoral work is about transcending, to use your word, Jeff, those boundaries. How did you actually do that? What does that look like? What would you advise for others? I think there's some key learning out of your projects that needs to be brought forth. And how to build connections among your teams. So something that struck me yesterday was wonderful camaraderie and interdisciplinary work within teams. I was surprised at how some teams didn't know about work other teams in this initiative were doing. So I thought, you know, this summit, of course, is a way of that sharing. But also, what about others, you know, who actually didn't get win in the competition, but maybe went on and got funding from open operating grants? Do you know who those teams are? Are you connecting with them? You know, you're a bigger group than the 18 project teams represented in this group. So I would encourage you to look at ways to extend that outreach, because there's a lot of learning there as well. We heard from Evelyn yesterday the importance of networks, and I would encourage you to, and maybe this has been done, but to think about mapping your intersectoral linkages and networks across your projects. What does that look like? Where are the gaps? Where are the strengths that you want to build on? I have no idea how I'm doing for time. Oh, I can see your watch, it's okay. So I have a few suggestions for consideration. I think, you know, mapping partners engaged, levels of government, you've worked with NGO and advocacy groups, relevant policy windows that you've tried to aim your work towards, identifying gaps to help plan knowledge translation. I think all of these would help to identify gaps and where you maybe can target some of your knowledge translation activities. As I said, around Science Council, emphasize your transformative findings and synergistic learning across and within teams. I suggest that you think about some working groups, and maybe this is already in the plans. I think you've got some of this going on, but you might want to look at the Global Alliance for Chronic Diseases as an example of how they've done that. They're working with teams that are in over 80 countries. They have lots of examples. I've given you the link there of working groups that have been forged. It's a way to actually bring cross-learning from different teams in diverse settings, and maybe some of the working group types that they've set up are relevant, like common indicators, systems approaches to scale up, working in a humanitarian crisis, process evaluation. Those are just a few examples. As I said, link with other environmental health researchers. And I heard some concerns yesterday about ethics approval for data linkage. Bring those to Tri-Council so that if there are changes that can be made in the Tri-Council guidelines, we get them in there, and then you've got a stronger voice to make to your own ethics committees about getting it right. What hasn't changed? Well, reward systems for academic research. This is what I heard yesterday. There's still only 24 hours in a day. I know that for sure. Links, I think, between government and academic scientists still remain a bit tenuous. That's been a touchy area for a long time. I think the importance of capacity building has come up in spades, and interdisciplinary research is challenging but essential. So now I'm going to give you a little exercise. This is my new retirement thing. Everything has exercise with it. So you're going to vote with the seat, your seat of your pants. Standing means you're voting yes. Sitting means you're voting no. If you're on a project team, involved in any way in a project team, you're a voting member. Otherwise, just watch. Brian, you're watching. So And I've oversimplified it. I know this should be a Likert scale. Don't take me there. Okay. But so standing means yes, and sitting means no. You feel, so everybody stand, who's a voting member. Come on, if you're on a project, you should be standing, even if you're a partner on the project, postdoc on a project. Oh, yeah, I got one more up that way. All right. So you feel that your project you were involved with engaged the right decision makers in sectors. Stay standing if it's a yes, sit if it's a no. Okay. You feel that you engaged policymakers early enough in project implementation. Oh, you sat down on that one. You feel that you worked with the right levels of government, and that could be self-governing governments, Indigenous peoples, municipal, provincial, territorial, or federal. Okay, a few more. You can stand up again if, you got 3 right, but 2 wrong. Not wrong, but you said no. Yeah, wrong. Number 4, you feel that you optimized the geographic and or policy diversity of the population you worked with in the design of your study. Okay, a few more stood up and a couple sat down. And that you successfully worked with the networks of your networked partners. Okay, all right, thank you. And if there was dissension among team members, that might be a place for a conversation. So let me just finish with a few provocations. The first is thinking about how the diversity of populations and contexts, which can be geographic and policy and so on, and structural determinants can be optimally harnessed for future studies on environments and health. Does your work have implications for policy? And if yes, who needs to be engaged and when? It's never too late. How do you plan to build on and extend the public's growing concerns about the environment and health? There's a lot of momentum in the public, a lot of conversations. So how are we going to use that going forward? And maybe that will come up in some of the ideas today. Second to last, what policy windows do you expect to open in the next few years? And how can environments and health researchers be ready for those? We heard quite a few references to policy windows yesterday. And finally, who are the main advocates for change in your policy areas of interest? And how can you involve them? So you can see I'm suggesting there is work still to be done, and I wish you well. Very impressive work that you've undertaken. So congratulations to all of you, and I look forward to the discussion today. Thank you.